हेलो एवरीवन। आज हम देखेंगे स्क्रब टाइफस क्या है। स्क्रब टाइफस इज अ डिजीज विच इज कॉज्ड बाय द ऑर्गेनिज्म नेम्ड ओरिएंटिया सुसुगामुशी. Orientia susugamushi differs substantially from Rickettsia species both genetically and in cell wall composition. That is, it lacks lipopolysaccharide. Orientia susugamushi is maintained by transoviral transmission in trombiculid mites. After hatching, infected larval mites, which are chiggers, the only stage that feeds on a host, inoculate organisms into the skin. Infected chiggers are particularly likely to be found in areas of heavy scrub vegetation during the wet season when mites lay eggs. Scrub typhus is endemic and re-emerging in eastern and southern Asia, northern Australia, and islands of the western Pacific and Indian Oceans. Infections are prevalent in these regions. In some areas, more than 3% of the population is infected or reinfected each month. Immunity wanes over 1 to 3 years and the organism exhibits remarkable antigenic diversity. Emerging cases in Chile and Africa challenge the classic epidemiology of scrub typhus. Clinical manifestations of scrub typhus. The illness varies from mild and self-limiting to fatal. After an incubation period of 6 to 21 days, onset is characterized by fever, headache, myalgia, cough, and gastrointestinal symptoms. Some patients recover spontaneously after a few days. The classic case description includes an eschar where the chigger has fed, regional lymphadenopathy, and a maculopapular rash, signs that are seldom seen in indigenous patients. In fact, fewer than 50% of Westerners develop an eschar and fewer than 40% develop a rash on day 4 to 6 of illness. Severe cases typically manifest with encephalitis and interstitial pneumonia due to vascular injury. The case fatality rate for untreated classic cases is 7%, but would probably be lower if all mild cases were diagnosed. Diagnosis and treatment of scrub typhus. Serologic assays, indirect fluorescent antibody, indirect immunoperoxidase, and enzyme immunoassays are the mainstays of laboratory diagnosis. PCR amplification of Orientia genes from eschars and blood also is effective. Patients are treated with oral doxycycline 100 mg twice daily for 7 to 15 days, azithromycin 500 mg for 3 days, or chloramphenicol 500 mg 4 times daily for 7 to 15 days. Some cases of scrub typhus in Thailand are poorly responsive to doxycycline or chloramphenicol, but respond to azithromycin and rifampin. Thank you for watching the video.